Welcome to Health First. Today we have been invited to take a tour of the Lifefirst Imaging and Oncology Center here in Coleman. Today we're joined by Dr. Karolewics, who is a radiation oncology on the medical staff at Coleman Regional Medical Center. And tell us a little bit about your educational background.
Thank you, Lindsay. I'm so happy to come here today, get a chance to kind of show some of the new things that we're doing here. I'm a graduate at Medical College of Virginia and University of Virginia. Graduated in 1996, and I've been here ever since.
Well, I know that we are very excited to have you here, and you've been practicing here in Coleman for 16 years?
Yeah, actually pushing 17. Yeah.
Oh, wow.
It's been quite a while.
Well, it has been a wonderful treat to have you on our medical staff and to offer this service to our community. And we are going to learn a little bit more about this wonderful new technology that you are bringing here. We have had radiation oncology here since you've been here, but this is an even more advanced treatment option.
Absolutely. And what we're trying to do is bring on the new techniques of stereotactic radiosurgery and stereotactic body radiotherapy, which is really where we're going as a field, and that's being able to deliver the radiation treatments much more precisely, much fewer fractions, so less treatment time for the patient, less side effects. And the key element to that is something that's been developed called rapid arc. Rapid arc, actually the technical term is called VMAT. It's volumetric modulated arc therapy. And they love abbreviations in this field. But it's just really a new approach to how to deliver image-guided intensity modulated radiation therapy. I'm really excited about doing that. We're one of the few places that can offer that. And for the patients, they're going to love it. I think they're going to see, as a result, that their treatment time is much quicker. A standard radiation therapy treatment using intensity modulated might take 15-20 minutes. And now with this technique, we're able to do it in 2 or 3 minutes. So there's much less time on the table. For the techniques of stereotactic radiosurgery and body radiotherapy, those procedures would take typically 80 minutes, 90 minutes per treatment. And now we can do that in under 20. So it's going to be wonderful for them. And also, it's going to mean a lot less radiation, so less side effects and less damage to normal healthy tissue. So we're really pleased about that.
Well, I'm very excited to learn more about it and to see this technology. And I know this is really revolutionary cancer care that we're having here in Coleman.
I think so. We're blessed. We're fortunate to have a medical community that really has been supportive. A hospital has been very supportive and mentoring as we go along, and it's very fortunate to be here at this time. So I'm thankful.
We will be right back, and we'll be taking a closer look at this new rapid arc technology in just a few moments.
When you remember to get your mammogram, you're not just remembering it for yourself. You're remembering it for everyone around you. It's just one more way you take care of them. So call your doctor. Because it's up to you to make the appointment. It's up to us to get you immediate, accurate, state-of-the-art results right here at home. Coleman Regional Medical Center Women's Diagnostic Center. Taking care of you so you can take care of them.
There's something about the moment when you first walk into that new home. It took a lot to get there, but Eva Bank made it easy to get the loan you needed. Eva Bank, as a part of the community, makes lending decisions right here where you live. Our lenders make the process quick and easy with rates you'll love. Visit your neighbors at Eva Bank today and let them help you with your new home loan, manufactured home, refinance, or remodel. Eva Bank, part of the community we call home.
The academic programs at Wallace State ensure seamless transfer to Alabama's 4-year colleges and universities.
I will be a musician.
Our students are well prepared to excel in whatever profession they choose.
I will be an accountant. I will be a teacher.
A world of opportunities awaits you at Wallace State Hanceville.
I will be a baseball player.
Wallace State, excellent choices, promising futures.
Welcome back to Health First. Today, we are joined by Dr. Karolewics, who is talking to us about radiation oncology and a new advanced treatment technology we have here at Lifefirst Cancer Center here in Coleman. And just so our viewers understand, what kind of cancer do you treat with your radiation oncology? I thought that was something that they might want to understand.
Yeah, actually, any type.
Okay.
The only one we don't treat is really pediatric.
Okay.
We're not equipped to handle pediatric patients, but short of that, anything you can imagine, from skin cancer, sarcomas, melanomas, brain cancer, CNS tumors, the whole gamut.
Okay, all right. Okay, now we're going to take a look at this amazing new technology. I got to see a sneak peek before we came back, and this is really revolutionary. I'm just really impressed, so I can't wait for us to take a look at it.
What we have here is a Varian Clinac linear accelerator. It's equipped with really all the bells and whistles imaginable to provide the latest treatments available in stereotactic radiosurgery and stereotactic body radiotherapy. To start with you, I'm going to introduce our lead radiation therapist, Ms. Nadine Jenkins, and she's going to help kind of show us how this thing works. And I can explain a little better that way as well.
Okay.
Nadine, if you don't mind, two elements that I mentioned critical to the treatment is image-guided and intensity-modulated radiation therapy. I'll get Nadine to kind of operate this to show you how image-guided radiation actually works. There are two components to this. The older one is called an MV image intensifier, and we're going to show you that first. It gives you an image of the patient, of their bony structure. It doesn't have the detail that you might typically see with a conventional X-ray, though. And that's usually all that most accelerators have, is just an MV image intensifier. It's called portal imaging. It uses a liquid crystal display. I think we can extend that, and we'll show you how that works. The X-ray beam actually is a megavoltage X-ray beam created from the accelerator, projected through the intensifier head onto the plate here, which is a liquid crystal display. And then that image is then seen at the control station. Typically, these images don't have the definition you would see with a conventional X-ray beam, though. So it's more of a fuzzy image we would normally see, and that's all that most linear accelerators actually have. That's the only capability. What we do have with the Clinac, however, is in addition to this, I'll show you two other parts of the image guided. The next one is called KV imaging, and that uses a low energy X-ray beam. We'll show you that. The beam is actually created from the module here onto another intensifier plate over there. The intensifier plate has much greater sensitivity and gives you a very precise X-ray image of the patient. It shows you the bony anatomy very precisely. It allows us to align the beams more correctly. We not only have this capability, though, we have something that's much more advanced called cone beam CT. I'm going to have Nadine show you that. I think it's interesting. It allows us to actually create a CAT scan image of the patient on the treatment table. So now we can only see the bony structure, but for the first time, I can actually see the tumor itself. I can see soft tissue structures. So it allows us much greater precision, and we can aim the radiation beams in real time at the tumor location, and not just where it was when we marked the patient out weeks ago. Well, that's how this is done here. The machine will rotate a full 360, and then recreate a digital image of that patient. The next part we mentioned earlier with the treatment of rapid arc is not just image guided, but intensity modulated radiation therapy. It's actually a very hard concept to explain, but what that is as the patient is being treated, the radiation beam is constantly being shaped and reshaped to conform to the tumor. I'm going to have them show you here, and our physicist is going to show you the MLCs. These are actually mechanical plates that are opening and closing during the radiation therapy treatment. And so it's constantly changing the shape of the radiation beam. The beam's only coming out in the opening between those metal plates. It actually has a micro MLC called micro leaf collimator head. Allows to shape the beams to millimeter precision. And what's nice about this is it will actually track the tumor using the image guided function and conform to the tumor as it moves around the patient. The two elements we talked about with the radiation therapy delivery is the image-guided and intensity-modulated radiation therapy. Rapid Arc is really revolutionary in how it incorporates those technologies. For a patient, a treatment consists of simply a 360-degree rotation of the linear accelerator. During that time, as the accelerator moves around the patient, it is constantly changing the output of the radiation, the energy, and the shape of beam, in addition to changing the speed at which it might treat the patient. What that does, for the first time, it allows us to treat a patient with one single rotation of the gantry. So the patient time on the table is drastically reduced. As I said, a standard treatment now is only 2 to 3 minutes, previously 20 to 30 minutes. Also, much less radiation to the patient. The actual radiation that the patient is exposed to is about 40% less than conventional IMRT treatments. So what that means to them is they're getting less dose to healthy lung tissue, soft tissue, wherever we're treating, and still getting a higher dose to the tumor. So really critical elements. I think that's going to see a significant change in radiation therapy delivery really across the country. In addition to the fact that we're giving lower dose to surrounding structures, as a result, we can also expect that second malignancies down the road would be decreased as well. Now, for a patient who's 20 or 30 years old, like a Hodgkin's lymphoma patient, unfortunately we have some breast cancer patients when they're that young. This will mean for them is that their likelihood of getting a second cancer in their 50s or 60s can be cut drastically. So we're really excited to do that. And for the first time in the techniques of stereotactic radiosurgery and stereotactic body radiotherapy, we can reduce the treatment time to a measure that's comfortable for the patient. The concepts of radiosurgery are not just using these elements, but we're giving very high doses of radiation to very small fields over short periods of time. So we're giving probably about 10 times the amount of radiation we would give per treatment, but we're only giving 3 to 5 treatments, and that's it. So you can imagine for a patient who has cancer, if we can do that radiation in 5 treatments versus 40, well, that's wonderful for them. So I think it's going to be very helpful, especially for older patients who have concern about driving back and forth.
Wow, this is really amazing technology. I know I'm so impressed by the level of care that we are now able to offer patients here in Coleman. You said earlier that we're one of the first, this is one of the
first sites in central northern Alabama. And we're really excited to be offering this treatment. I believe that what we're seeing is a revolution in radiation therapy delivery, and the technologies, especially the Rapid Arc, are going to be key to that. It's delivering the treatments more precisely, fewer side effects, and better outcomes. And that's what we're seeing, especially for lung cancer. It's been wonderful, very rewarding to see that in a disease that typically has a bad prognosis. With these new technologies, we can control that tumor in the lung 90 to 95% of the time, which is amazing. So
wow.
I'm very happy.
So just so our audience is clear about the definite benefits of what this is to traditional radiation therapy, I know you've kind of covered that a little bit, but let's be real specific and say this is why this is better.
Primarily time. For the patient, it cuts their treatment time by a factor of 10. Much greater comfort than on the table, less difficulties lying flat on a very hard treatment table. Precision, much more accurate than we have now. We can actually see the tumor for the first time, locate the tumor live while we're treating that patient, and we can adjust the fields to target just where that lesion is. And it's extremely reliable. It's a simple in concept. It delivers the treatment accurately over and over again, so we're doing just a much better job overall.
Well, I know it is really amazing. Is there any specific type of cancer that this works better for than others?
The technologies of the Rapid Arc really can be used in any patient that we're treating with intensity modulated radiation therapy, which actually is about half of the treatment that we give here, about half of the tumors. However, it really becomes critical when we're doing the stereotactic radiosurgery and stereotactic body radiotherapy. So for CNS tumors, brain tumors, metastatic brain tumors, lesions around the spinal cord, very important. For lesions in the lung, critical because we can, for once now, spare healthy lung tissue, which unfortunately these patients have already some pulmonary compromise. For tumors in the pancreas and the liver, very helpful, and it's been used primarily in them as well. And also we're seeing prostate now. So it's a wide range. But for any tumors that require high doses with extreme precision, this will be what they're going to get.
Okay. So what a it's refreshing for me to know that we have this kind of technology here in Coleman, and our patients that come to Coleman Regional don't have to seek treatment in a bigger city where you would traditionally think something like this would be available. They don't have to go to Huntsville or Birmingham. We have that right here.
You're absolutely right, they don't. And I think we're really blessed in Coleman, to be honest with you. We're so fortunate we have a very supportive medical community. We have great, strong leadership at the hospital, and working together and to develop these things and provide that level of care. So it's, I think, a little unique. You can look at other sites in the area, and we're the only ones. And so I feel it's very rewarding and very happy to be here.
Yes, and I will also say the aesthetics of this clinic is it's refreshing. Walking in, you see the beautiful, everything is serene, and you don't think of a sterile clinic. I mean, we've got these beautiful pictures behind us. You've even got the beautiful images on the ceiling. And, to be a patient and to go through a cancer diagnosis is scary enough. But to come in and have advanced care and a beautiful environment has got to be refreshing for patients. So I just want to applaud you and the clinic for doing such a wonderful job, and I'm sure your patients appreciate that as well.
I hope so. I thank you very much. I do appreciate it. Our mission statement here is really to provide that university level care, but in a community setting. And what we do really is focus, and we tell patients, mind, body, and spirit. We're here to care for them, not as a number, not as a disease entity, but as a person. And that's how I'd want to be treated.
Absolutely. So we've really taken a close look at the new Rapid Arc technology. What other technology treatment options are here at the center?
Part of what we provide here is the image-guided therapy we mentioned, and in order to do that, we have what's called a large bore CT-RT scanner, and hopefully we'll kind of show that a little bit later. That device allows us to accurately image the entire body of the patient. We can visualize the tumor. Not only that, it allows us to track the tumor during normal respiratory motion. So we have the technology called respiratory gating, or RPM. And for the first time now, we can actually see a tumor as the patient's breathing in and out, and we can actually follow that tumor or turn the beam off and on as it gets within that field.
Wow.
Level precision never had before. Not only that, we do offer a number of different treatments. We do offer what's called radionuclide therapy. So we use that for patients, and that's in conjunction with the hospital. Treatments are done through the hospital. We'll do for bone cancer. We have treatments for that. We'll give for thyroid cancer. And for lymphomas, we'll use monoclonal antibodies that are tagged to radiation sources. We have brachytherapy, where we do implants. We have a very good program with that, working with the surgeons, the urologists here for many years. We've been very successful in that. What we're happy to bring along is this new concepts of the stereotactic radiosurgery and the body radiotherapy. Where, as I said, for the first time now, we can deliver an entire treatment course in just 3 to 5 treatments versus 8 weeks.
Wow.
So that's really exciting to see.
That really changes someone's quality of life, really, when they're going through treatment, doesn't it, to be able to reduce that?
It really does, and you're talking about much less side effects. Because the beams are aimed more precisely, you're able to protect the healthy tissue. So for older patients or patients not able to tolerate conventional therapy, we now have an alternative.
Well, this is wonderful. I know for the hospital, it's wonderful to have this available to our patients. And to have this service here, again, and we are very blessed in Coleman. I don't think people realize how lucky we really are to have the wonderful medical community that we have, with all of the advanced technology that we have for patient care, that people don't have to leave.
You're absolutely right. And certainly I've covered other sites in the state, and you just don't see that. You don't. And it's just a kind of spirit here. And I think what's nice about this area is that most people know you by name. They're friends. They're not just patients, but they're often family members and friends. And that makes it much more rewarding.
Absolutely. Well, if you need more information about how to get in touch with Lifefirst, you can contact their office at 737-2285. And if you need more information about Dr. Karolewics, you can also visit the CRMC website at crmchospital.com, and we have his full bio. And so you can get information. And it has been a pleasure being here today. Thank you for letting us have a tour of your facility and for sharing this information with our community, and for being a wonderful physician in our community and providing this service.
Thank you. Thank you for coming, Lindsay.
Thank you for tuning in to Health First. And again, if you need more information about any of the information that you have received during today's broadcast, please feel free to visit us online at crmchospital.com, or you can call the CRMC Marketing Department at 256-737-2600.